Hello, my friends and my colleagues and my fans. Today I will talk about an important issue, which is the relation between the liver and the cardiovascular system, or the relation between the liver and the heart, and how does the liver affects, or liver disease affects the cardiovascular system, or what we call the liver heart link, or the hepato or cardiohepatic or hepatocardiac relationship. Simply, we can summarize the possible involvement of the heart in patients with liver disease as follows. Number one, the cardiac problems is the commonest mode of death in patients with chronic liver disease and liver cell failure. In fact, the pathogenesis of cardiovascular abnormalities in patients with liver disease is multifactorial and involve two major groups, what we call neurohumoral mechanisms and vascular dysregulations or cardiovascular dysregulation. So we have neural and humoral or metabolic dysregulations and vascular dysregulations. Through these two major mechanisms, we can summarize the pathogenesis of cardiac involvement in patients with chronic liver disease. One of the commonest presentations, cardiac presentations or cardiac problems in patients with chronic liver disease is pericardial effusion as a part of generalized edema in patients with liver cirrhosis, being the most common form of chronic liver disease. So pericardial effusion might be a complication of chronic liver disease, cirrhotic chronic hepatitis, for example, whether alcoholic or non-alcoholic, post-viral hepatitis related to hepatitis B and hepatitis C. So pericardial effusion might be, we can consider it as a common presentation of chronic liver disease, especially in end-stage chronic liver disease and in advanced cases of liver cirrhosis. We get pericardial effusion. So this is number one. Number two, also we might get in liver cirrhosis a condition called cirrhotic cardiomyopathy, which is a form of cardiac muscle involvement in patients with liver cirrhosis, and we get, of course, liver ventricular ejection fraction reduction, especially with exercise. And then it might progress in advanced cases or later on to even cardiac failure, heart failure. So the cirrhotic cardiomyopathy is rather a chronic end-stage presentation at the level of the heart in patients with end-stage liver disease, cirrhotic cardiomyopathy. And this is a pathological involvement of the cardiac muscle in cirrhotic patients. And it's also related to multiple mechanisms, and the most common is neurohumoral, that is affection of the cardiac muscles by the retained toxic metabolites. So the effects of the retained metabolic toxins due to the liver failure, their effect or their action on the heart might be a form of toxic cardiomyopathy related to the metabolic factors, and also might be related to vascular changes affecting the coronary microcirculation, and this also might cause the cardiac muscle dysfunction. So the cardiac cirrhotic cardiac involvement is a well-known category of cardiac involvement, to be more specific, cardiac muscle involvement or myocardial involvement in patients with liver cirrhosis. So this cirrhotic cardiomyopathy, with all its spectrum and ending in heart failure in patients with liver cirrhosis. Also, another form is related to the hyperdynamic circulation in cirrhotic patients due to retention of the vasodilator metabolites due to failing liver, because these vasodilator metabolites are normally metabolized in the liver, and when the liver is failing, there will be retention of such metabolites, and they will cause vasodilatation, and they induce a state of hyperdynamic circulation, and this might be associated with what we call high cardiac output failure. High cardiac output failure. So high cardiac output cardiac disease also is another sort or another form of involvement of the heart in patients with liver cirrhosis, high output cardiac failure. Another form is related to the development of pulmonary vascular malformations and pulmonary vascular dilatations in patients with liver cirrhosis, and this also might affect the right side of the heart or the right ventricle and cause right ventricular dysfunction and right-sided heart failure. Also, the heart might be affected in terminal cases of liver cirrhosis due to the metabolic acidosis and due to hypoxia, which, for example, is rather a problem in patients with I already discussed it yesterday, the hepatopulmonary syndrome. The hepatopulmonary syndrome is associated with low arterial oxygen saturation or hypoxia, and this hypoxemia might affect the heart, and causes also ventricular dysfunction and later on ventricular failure. So the effects of hypoxia, especially in patients with hepatopulmonary syndrome. And one of the triad of the hepatopulmonary syndrome I mentioned yesterday is hypoxemia, and the hypoxemia might affect all the body systems and tissues, and especially the heart and the brain. And in the heart it will cause, of course, many cardiac abnormalities ranging from arrhythmias, changes in the heart rate, dysrhythmias, tachycardias or tachyarrhythmias, bradyarrhythmias. So hypoxia, the effects of hypoxia on the heart with cardiac rate and rhythm disorders, and in advanced cases it might also precipitate heart failure in association with other factors which affect the cardiac muscle and ending in ventricular failure. So the effects of hypoxia and the effects of metabolic acidosis in patients with hepatocellular failure also, because as we all know, in patients with advanced liver disease and liver cell failure, we might get a state of metabolic acidosis, and this also might be a factor affecting the cardiac muscle function and causing ventricular dysfunction and ventricular insufficiency and later on frank clinical heart failure. So these are all the effects of liver cirrhosis or chronic liver disease on the heart, and these are affecting the heart either directly or indirectly, as I mentioned, the state of cirrhotic cardiomyopathy with structural changes, the state of high cardiac output or high cardiac output failure due to hyperdynamic circulation in patients with liver cirrhosis, and also the pulmonary vascular malformations and the effects of hypoxia and metabolic acidosis on the heart, causing a wide form of arrhythmias and precipitating heart failure. So, in addition, of course, to involvement of the heart in patients with the hepatopulmonary syndrome, as I mentioned, due to the effects of hypoxia. So these are the how is the heart is involved in liver cirrhosis, and as I mentioned, it is multifactorial. But the major and the common and more common is the involvement of the pericardium with pericardial effusion due to hypoalbuminemia, same pathogenesis of ascites. And as I mentioned before, pericardial effusion might be part of generalized edema in patients with end-stage liver disease with advanced and chronic hepatocellular failure. So there might be also pericardial fluid or pericardial effusion in such cases. And this also in some cases might, in severe cases, it might progress into cardiac tamponade, pericardial effusion with cardiac tamponade due to compression of the heart and the impediment of movement of the heart and interfering with proper cardiac contractions, and it is a form of a stiff heart syndrome, or to be differentiated also from restrictive cardiomyopathy. So different forms of affections of the hearts, functional, structural, that is physiological, pathological, ending into heart failure, are commonly met with in patients with liver disease, especially with patients with chronic liver disease and in cirrhotic patients. They might end in cardiac failure, they might end in pulmonary failure, they might end in pulmonary edema. So these are possible potential complications, cardiovascular and cardiopulmonary complications of chronic liver disease. And as I mentioned, it is multifactorial as regards their pathogenesis or pathophysiology, but mostly involving humoral and neural dysregulations, in addition to also dysregulation, especially at the level of the microvasculature of the lungs and microvasculature of the heart, impeding cardiac function and ending in heart failure, as I mentioned. These are all the possible modes of involvement, of course, in addition to other indirect modes of involvement of the heart in pathologies which involve both the liver and the heart concomitantly, like, for example, in hemochromatosis, which might affect, it's a disease, it is a metabolic disease with iron storage, which might affect the liver and might affect the heart at the same time. And so this is a form of a concomitant or simultaneous involvement of the heart and the liver by the same pathology. This is different from the issue of the disease starting in the liver and causing cardiac complications, as exemplified by liver cirrhosis, which I mentioned just a few minutes before. This is here a liver disease with secondary involvement of the heart. Heart disease with secondary involvement of the liver, of course, is patients with any form of heart failure due to underlying cardiac disease, whether congenital heart disease or valvular rheumatic heart disease or ischemic heart disease, causing heart failure and congestive hepatomegaly. And this is also another form of secondary hepatic involvement due to primary cardiac disease. So here the liver is a complication of the cardiac disease, congestive hepatomegaly due to cardiac right ventricular failure, causing enlarged tender pulsating liver, what we call congestive hepatopathy or congestive hepatomegaly, in patients with right-sided heart failure or biventricular failure. So this is another form. This is the opposite way around. That is the liver as a complication of primary heart disease. Another or a third category is this which involves both the heart and the liver simultaneously or sequentially, as I mentioned, like patients, for example, with hemochromatosis. It involves both the heart and the liver. Also, alcoholic patients, they might get alcoholic patients, they might have alcoholic liver disease and alcoholic cardiomyopathy. So here the same toxin affected both, and I mentioned it, that the most common three organs affected by alcohol are the liver, the heart, and the brain. So involvement of the heart, liver, and brain is common in alcoholic patients with alcoholic liver disease, all the spectrum of alcoholic liver disease, from acute hepatitis, acute alcoholic hepatitis, to chronic alcoholic liver disease, to alcoholic liver cirrhosis, and to hepatocellular carcinoma. And on the other hand, in the heart, there might be alcoholic cardiomyopathy, which is a form of congestive or dilated cardiomyopathy common in chronic habitual alcoholics. So alcohol here is a common comorbid condition linking both the heart and the liver in the same patient, causing cardiac pathology and liver pathology, in addition to other organ and system pathology in alcoholic intoxication. So this is another form. So I mentioned the hemochromatosis, I mentioned alcoholism. Also, there might be in patients with infective endocarditis with systemic embolism. The embolus may go to the hepatic artery, and they cause also a problem or cutting of the blood supply to the liver if there is systemic embolism complicating infective endocarditis or complicating atrial fibrillation in cardiac patients with AF or atrial fibrillation. So this is also another form of involvement. Veno-occlusive disease involving the liver and veno-occlusive disease involving the lungs. Also, they might directly affect the heart, and there will be a form of veno-occlusive disease in both organs. And so these are all clinical possibilities which we should think about. Also, the abnormal liver function tests in patients with infective endocarditis being the most common serious acute infection in the heart, the infective endocarditis affecting the endocardium, especially the aortic valve or the mitral valve in patients with aortic regurg or mitral regurg, whether rheumatic or prosthetic cardiac valve endocarditis. And this also might be associated with abnormal liver function tests and even possible emboli in the liver itself in advanced uncontrolled non-treated cases. So the effects of emboli arising from the heart on also the liver, same the effects of emboli arising from the heart on the brain, because the systemic emboli can reach to any of the vital organs in the body or even to the peripheral circulation and cause embolic manifestations, vascular obstructive manifestations in the organs and in the limbs. One of them may be in the liver. So these are, and the source of embolus is in the heart, and the commonest is atrial fibrillation or patients with endocarditis. So whether this is due to effect of toxins on the liver or effects of emboli on the liver, this is an association between endocarditis and liver pathology. The simplest, as I mentioned, is just abnormal liver biochemistry or abnormal hepatic enzymes in patients with infective endocarditis. So this is all possible combination of symptoms linking both the liver and the heart in the same patient, whether it started in the heart and then affects the liver, or it starts in the liver and then affects the heart in later stages in chronic hepatitis and cirrhosis and in patients with hepatocellular failure, or number 3, affection of both organs concomitantly by the same pathology or the same toxic agent or the same chemical agent, as I exemplified it by alcohol. So about the mechanisms, as I mentioned, of cardiac complications in liver disease is multifactorial, related to neurohumoral mechanisms and also vascular dysregulations in such patients. This is in short the heart in patients with liver disease. Thank you so much and have a nice day.